Good morning, good afternoon, good evening. Thank you for joining us from whichever time zone you're in, and welcome to day 2 of ICS 5. We got off to a great start yesterday, from starting with the breadth and depth of CZI's commitment to health research and ending at the end of the day with a look at the breadth and the depth of the IHCC cohorts in their many different forms. In between, we had informative updates on the working groups, on research activities, and a memorable conversation on lessons learned from global pandemic management in US, Chile, and globally. Today's theme is emerging data and industry perspectives for improving longitudinal population studies. We're starting with a keynote in a couple of minutes from Dr. Madeleine Thomson on integrating environment and climate data into longitudinal population studies. We're going to have 2 presentations, one on virtual cohorts to leverage health data, and another one from David Glazer on intro to cohorts in a box. We'll have a couple of panels, one on using cloud-based infrastructures for hosting cohort data, and one on industry perspectives. And then we're going to have 2 concurrent roundtables. There'll be a starter pack on policy documents and guidelines, and a second one on ancestry analytics for polygenic risk scores and metabolomic data. So to start this session, it was a great pleasure to introduce Dr. Madeleine Thomson. She's the head of climate impacts and adaptation at Wellcome Trust, where she seeks to advance the organization's vision of a world where catastrophic climate breakdown is averted in a way that allows human health to flourish, and a mission of putting health at the heart of climate action. Prior to her current position, she was the interim head of Our Planet, Our Health, and before joining Wellcome in July of 2019, she was a senior research scientist at the International Research Institute for Climate and Society, Columbia University, where she directed the World Health Organization's Collaborative Center on Malaria Early Warning Systems and other climate-sensitive diseases. So this complete bringing together of the message around climate, environment, and health. Madeleine, over to you.
So I'll just start by sharing my slides. Are you able to see them?
Yep.
And
they're in preview mode. Full mode now.
Okay, let's start at the beginning. Well, first of all, thank you so much for the invitation to present to this conference. And it's a very exciting opportunity for me personally, because although I come from a health background, I have been working for many years at the interface with climate and health, and particularly the idea that climate information, climate data needs to be mainstreamed into health research and health decision making. And so I'm just going to start my presentation with some comments made by the UN Secretary General, Antonio Guterres, at the recent COP27 climate conference in Sharm el-Sheikh. And unfortunately, I was there along with, it wasn't unfortunate to be there, but I was there along with other colleagues from the Wellcome Trust. But the mood of the meeting at the end, I would say, was somewhat depressing. And the comments from the Secretary General was that our planet is still in the emergency room with regard to climate change. That was his first comment, and the fact that we need to still drastically reduce emissions if we are to protect our climate. And this is an issue that COP27 did not address. And I think a lot of people don't really realize that. A positive outcome was a fund for loss and damage, which is essential, but it doesn't answer the climate crisis about washing away small island states, for instance, off the map. And the world still needs a giant leap on climate ambition. And finally, the red line we must not cross is the limit that our planet shouldn't exceed 1.5 degrees above pre-industrial temperatures. So a fairly gloomy report from COP27. And the reason why it's gloomy is really, I think, presented in this graph, where we fundamentally have to prepare for a warming world. But how successful our preparations will be is fundamentally dependent on mitigation choices made during this decade of action. That the decade of action was set as 2020 to 2030, and we are failing to meet our obligations to move on the Paris Agreement. So within this context, I would like to talk a little bit about climate risks and how we understand climate risks to health. They basically fit the basic risk model here set out by the IPCC, where you have, on the one hand, climate, the natural climate variability, as well as that which is driven by greenhouse gas emissions, creating climate hazards, whether these are floods or droughts or hurricanes, etc. We have the vulnerability of populations and individuals, and we have the level of exposure of those individuals, all coming together to create an estimation, if you like, of the risk that we're at. And it is the impacts of climate that create these risks, and we are furthering those risks through the greenhouse gas emissions that we produce and the land use changes that we decide on. And of course, there are many socioeconomic impacts that connect to this, and our behavior in response to the climate crisis is critical. So in that context, I want to say something about our strategy here at the Wellcome Trust in terms of climate. And really, it's how can we use health evidence to tip the feasibility scales towards limiting climate change to the 1.5 degrees in line with the Paris Agreement? And how can we best protect vulnerable populations from the effects of climate change we will now inevitably experience? And so this now comes at a time where Wellcome has dramatically changed its vision, its strategy, its way of working. And it's as established in October 2020, Wellcome's vision statement is now that we support science to solve the urgent health challenges facing everyone. And we still invest in discovery research, which we're very well known for. We continue to invest in infectious disease, which we're also very well known for. But our new challenge areas are focused on mental health and climate change and health. And of course, we're also looking at the intersection of these four areas as opportunities for investment. Essential to our new strategy is the diversity and inclusion and research culture being embedded into the work that we fund and do. And just to say that I think it was in February this year, our CEO, Jeremy Farrar, committed the organization to spending at least 16 billion in the next 10 years on these priorities. And as mentioned earlier on, so our vision statement, a world where catastrophic climate breakdown is averted in a way that allows health to flourish, and a mission statement putting health at the heart of climate change action. And to do this, our climate challenge has four goals. First, quantifying the effects on health of climate change, identifying the potential benefits to health of climate change mitigation, establishing the evidence of the effects of health on climate change adaptation actions, and third, creating a global climate and health community, building the field, if you like, of climate and health. And so our premise fundamentally is that advancing the availability and accessibility of research and evidence on the direct and indirect effects of climate change on health will help to inform and accelerate innovation and scaling up of health enhancing mitigation and adaptation actions, policies and practices of government, civil society and the private sector, and also by communities. And so that's our core premise. We know, of course, that there are many pathways to impacts on health, and I'm just illustrating here with rising CO2 levels, but of course there are other greenhouse gas emissions that are important, and there are other mechanisms that are important that go through the oceans as well as through the atmosphere. And so there are many complicated pathways for climate change to interact with health. I just show one pathway, and this is a pathway to vector-borne diseases. And as you can see, you start to get quite detailed on the well, my right-hand side, it would be the impacts of drought and increased temperatures on the thermal performance curves of pathogens, vectors, reservoir hosts, etc. And on the left-hand side, we see melting ice and its impact on rising sea levels. That affects the saltwater content of estuaries, that changes the species dynamics and the transmission dynamics of those vectors in those contexts. So there are many different pathways, and these also, of course, interact with human and natural systems, resulting in the loss of livelihoods, increased population vulnerability, economic losses, and population displacement and migration. So a complex system and multiple pathways between climate and health outcomes. There's a study by Barringford et al. Last year that really did a fairly comprehensive review of the published data on climate and health research. And it really shows you that climate and health research is still quite limited. There's a significant number of publications on respiratory diseases and emissions, but there are many, many gaps in the research that has been done, and in particular, research in low-income countries. So there's absolutely a field of investigation to invest in here. And this is something that I think that the longitudinal population studies are potentially highly relevant to developing this research agenda. In part because, of course, the longitudinal population studies provide information ranging in scale from the molecular level, biomarkers, to population-wide social, environmental, and health outcome data. And of course, there's a global reach for many of these studies, although it's somewhat underrepresented in lower and middle income countries. So I think it's just that's the context, if you like, of how we can see the LPSs fitting in to a broader climate and health agenda. And there's some work that's already been done that's been quite effective at integrating pollution studies, for example, from LPSs and environmental data. But I believe there's many more opportunities ahead, and we'll show how that is developing. One of the main things I wanted to report on, if you haven't already seen it, is a report that we commissioned last year from Hannah Nissan, a climate scientist, Peter Diggle, leading statistician, and Claudia Fronteras, on the how we might combine climate and health data. Because if we want to develop significant analyses, we need to primarily understand how we might integrate data from the climate side with the data that is produced in the LPSs. And this means really actually understanding the climate data. The community here obviously has a pretty good understanding of the LPS data, but we now need to start thinking about what the attributes of climate are that are important to understand for health research, what data are required to capture climate exposures and their effect on health outcomes, and what methodological challenges are involved in combining the health and climate data. So I recommend that if you haven't seen it already, that you are interested in this area, that you access this report. It is available in the Wahova system and with the slides. But I'm going to include in my remarks some of the highlights, if you like, from the report. And the first question is about, sort of having a health community that actually has some understanding of climate. This might be a fairly simple question: why it is so much cooler in the shade than in the sun. You might think erroneously that the sun warms the atmosphere, and if there's a tree between the sun and your kangaroo, then the kangaroo will be cool, but that's not the case. It's the sun warming the ground, and it's the ambient temperature in that heat that is reflected that is important. And these details and a lot more information are in this book that I produced with a colleague, Simon Mason, a climate scientist, really trying to unpack information on the climate that would be relevant to the health community in particular, because there was a significant gap, if you like, in the market, and it's available, it's online, etc. So building climate knowledge in the health community, I think, is going to be essential to building the use of LPS data in climate-related studies. And so primarily, what is it about climate that makes it potentially ideal is an additional layer of information for understanding and predicting disease risk. And here, I think it's an understanding that climate has a climatology. Yeah, we are now in the, well, I'm in the Northern Hemisphere, we're going into our winter. It's relatively cool. We expect it to be cool in the winter. Different parts of the world have different climatologies. We know those climatologies, by and large, are going to be similar year on, year out. That many parts of the world have strong seasonality in the climate that is reflected in disease outcomes. Going back to the vector-borne diseases, very commonly they are epidemics, and seasonal rises in vector-borne diseases occur halfway through the rainy season and extend into the following dry season. There's a diurnal rhythm to climate, day and night, which also impacts on health outcomes. And of course, there's potential predictability at multiple timescales. So we can go from weather, understanding the weather, seasonal timescales, El Nino and the Southern Oscillation, decadal timescales in climate, and then of course longer term change representing climate change. So understanding how climate is measured and predicted is key to this, whether it's meteorological stations, ocean buoys, satellite data, or global models. They all produce different types of data. Some of that data can be integrated into common products. Understanding the role of uncertainty in the data sources and how that uncertainty can cascade through models is particularly important. Very often the health community is very careful about its own data, but I would say a little bit sloppy about using data from other sectors. And so understanding that data is critically important, and particularly understanding the relationship between local data and global products that are easy to access on the internet. And quite often global products, they look great, they're great for global studies or large-scale regional studies, but when you look locally, they really are not ground truth sufficiently at the local area to provide the detail that is necessary for local studies. And this is just an example of a particular source of climate data, the ENACS products, which are very detailed and based on a lot of observational data as well as satellite and model data, and whereas global products do not have that level of observational data. And as a result, different global products from different providers can produce quite significantly different results. This is just a map of the seasonality of heat waves using different global data sets. And it shows you that generally they agree, but they also have significant areas of error or disagreement if you start looking in local areas. So within the LPS report, we have the different types of climate that can be represented, how they occur at different timescales. For instance, a tornado or a hurricane may occur in a particular area over a number of hours, whereas a drought may actually take months, if not years, to build up. And so understanding the different timeframes of climate events, how they behave, is really important in terms of considering how you might use data of those events in your studies. And then the weather and climate timescales, I've mentioned them just now, but they are, what is predictable in the next few hours, the next few weeks, the next few months, the next few years, and then over longer timeframes is quite different. And some things are not obvious. For instance, when we look at weather forecasts, we tend to think, yeah, they work for the next maybe 3 to 5 days. We're fairly confident in that. But once they start going beyond that, we're not very convinced that we could predict what the weather is going to be like in Thursday, say next week. Yeah, but if we look at seasonal timescales, there is some predictability again, and this is because there are different drivers for the different timescales of climate. So understanding those different drivers is important, not only for predictability, but understanding the uncertainty in the data. And one of the reasons that we all need to understand as well is why climate varies so much. And it's part because of the altitude, in part it's because of the latitude. Very often it's because of a land-sea contrast. So coastal regions have a particular climates. And then, of course, there's the land cover as well. So climate over forested areas versus climate over deserts has a particular nature to it. So just starting to think through the different characteristics of climate is going to help understand how we might use the data. And so our recommendations in brief from the report is that when we start to develop analyses on climate and health outcomes using the LPSs, first of all, let's be policy driven, i.e. how are we going to use the results of the research, adopt a systems approach to really understand the nature of the problem and how climate relates to it, and develop and support initiatives for the co-production of study design and data collection. We need to develop a field of climate and health research and recognize and seek to influence the governance structures needed for proper integration of the data. This is particularly important because actually it's quite challenging to access the data from different communities in a way that works for this type of study. And one suggestion also in the recommendation was establishing an international centre of excellence. In brief, here's a way of, I would say, a lot of the climate and health community discussions go. Start off with like, what do you want? And then what have you got? And then somewhat unrealistic expectations of what might be available from the climate community. So you do have to set up a rapport with climate colleagues to really understand what is available and what you can actually do with it. And to help in this process, we funded work at the WHO-WMO joint office, where there is now a portal that you can access to connect to the climate community, to connect to, in different countries around the world, to connect to the various reports, data sources, etc. And I'd just like to highlight the fact that we've been working with CDAX to help them incorporate climate data in their new proposal, in their new project, which we're very excited about. And just talking about the next COP, COP28, in preparation for that, one of the areas that we're looking at investing in now, and we hope to launch this in the new, sometime in the new year, that is unlocking the urgent climate action by making climate impacts of health on health visible. And this is a combination of data-driven evidence, filling specific evidence gaps in lower middle-income countries and disadvantaged communities, and then combining that with the power of communication, the media, etc., so that we can really get strong narratives of the relationship between climate and health that can drive action at the local and at the global level. So I've just remind you that the links to those documents are available on site, and thank you all for your time.